All right. Again, so welcome everyone, and thank you so much for joining us today. Covenant Family Solutions is an innovative provider of mental and behavioral health care services based in Cedar Rapids, Iowa. We offer therapy and medication management for individuals, couples, and families. CFS has 4 clinics located throughout Iowa. We also serve individuals throughout the United States through Strengthen You, our virtual care platform. Today, we will be discussing the mental health impacts of receiving a serious medical diagnosis. Whether this is for yourself or a loved one, it's a very important topic. As many of you know, this month is Breast Cancer Awareness Month. This disease, among many others, both very critical diseases and chronic disease, cause an immense amount of pain and suffering for so very many people every single day. While the physical symptoms are often top of mind, we want to highlight how mental health is impacted as well. Before we get started, I have just a couple of housekeeping items. First, our webinar is being recorded, and we will be sending out a link later this week for you to be able to rewatch the presentation or share with friends and colleagues. Next, all attendees will be muted throughout the presentation. If you do have questions, please use the chat feature to submit them, and we will answer as many questions as we can get to at the end of the presentation. For any left over, we'll go ahead and we'll answer those via email after the presentation. If you are looking to get a CEU for today's presentation, the syllabus for the presentation is available on the event page. You can also send an email to communications@covenantfamilysolutions.com to request a certificate. Individual licensing requirements can impact whether or not the webinar does qualify for CEU credit in your particular state for your particular degree or licensure. All right. We also welcome you to join us in the conversation online on Twitter. If you want to tag us with @CovenantFS and use hashtag CFS webinars, you can join our conversation. All right, now I am very privileged to introduce you to today's presenter. Dr. Doug McPhee has years of experience providing therapy to families, couples, and individuals. Previously, he's worked in healthcare settings, training medical residents about behavioral health and best practices. Presently, he serves as clinic director for the Olson MFT Clinic and is an assistant professor at Mount Mercy University here in Cedar Rapids. And we are very, very fortunate to have him on our team here as well at Covenant Family Solutions as one of our very talented therapists. So thank you so much, Doug, for joining us this afternoon and being here. And I'm going to turn it over to you now.
Well, I'm just realizing that I'm wearing the same shirt. So obviously I have one good shirt that I wear for the biggest occasions. So anyway, that's funny, but I'm really thrilled to be here. I appreciate Anna and her introduction. Before I really dive in, I of course appreciate everyone that's here, and I'm just thrilled to see the people that are tuning in. This is a really exciting opportunity to talk about this topic that's really important to me and my research and my scholarly interests. So I also just want to start by thanking Anna and Cassie, who have been so helpful in putting this whole webinar together. And they even put my slides together. I just kind of gave them my content and they did the whole thing. So I just really, really appreciate their support and involvement with this. All right, if you'll click to the next slide. I want to start with a fact that I've come to be very certain of, and that is that disease truly does impact everyone. I never imagined that I would become a researcher of chronic disease. It wasn't what I started out with as I began my kind of graduate training. But I came to see more and more clearly how disease is impacting everybody. There's not a single person I know that hasn't been impacted in various ways by disease, whether it be personally with a diagnosis of ulcerative colitis or chronic migraine or breast cancer, whether it be a family member that's receiving these sorts of profound diagnoses that impact us and our lived experiences so much. We are all shaped by illness. We're shaped personally or through our relationships with people we love by illness and its impacts. Now, as we start talking about serious medical conditions, to me, there's kind of a typology. There's maybe two different branches within this conversation of serious medical conditions, one being acute and life-threatening conditions, and the other being chronic conditions. And this conversation is mostly going to center around chronic conditions. That's what I've done with my research to this point, is mostly examinations of chronic conditions. And so that's kind of where we'll hang out. I will say, I think there's a lot of commonality in the lived experiences of patients and families suffering from both acute life-threatening conditions and chronic conditions. And then there's certainly some unique aspects. There's certainly pieces of it that aren't common. And so if we had more time, we could dive into all of it. But for this time that we have together, I'll be zoning in on the chronic conditions mostly. So one thing that I'd love to throw out, and I don't know what this crowd is going to be like. You don't have to, but I would welcome anyone that has comments in the chat feature to these questions. I would totally welcome that. I'd love to see kind of what your thoughts are. And if you do have thoughts, I'm so not good at managing Zoom stuff. So if anyone does chat something, I'd love it if Cassie or Anna maybe unmute and let me know what people are saying. But I'd love to start with considering what are some of the common psychosocial experiences for both patients as well as family and loved ones when it comes to these serious medical conditions. Now, psychosocial might be a term that's a little unfamiliar to some of you. If you'll click to the next slide, Anna. So what I mean by psychosocial is simply psychological experiences and social experiences. It's this mixture of our psychology, our emotions, our relationships. That's what I mean when we look at psychosocial. So next slide. And yeah, so what are some of these common things? There's a lot. We could dive into a lot. But I've done some research over the years in these areas, and I'll try to summarize some of the most common experiences. One thing that I think is a very common experience for patients is grief, right? It's a loss of normalcy in their mind. What they expected isn't maybe going to happen anymore. There's wrestling with uncertainty. There's challenges of, is this going to get better? Is this going to not get better? There's all this uncertainty. I'm seeing that Fanny said shame. No one knows what you're going through. Absolutely. There's a shame. There's a sense of burdening. Patients end up feeling that they're being a burden on their family members, on their loved ones. That's an absolute part of the lived experience. Another big piece of the lived experience is the experience of seeking medical care. And sometimes those are really beautiful experiences. Oftentimes those are really challenging experiences for patients where they're frustrated that there's not better answers. Maybe they're frustrated by how they're treated by nurses, providers, medical staff. I appreciate Hugo's comment, being depressed and living with regrets. Absolutely. Depression has a high comorbidity. As we look at serious medical conditions, we can experience hopelessness. These are really appreciated comments. For family members, I don't think we include family members in the conversation enough. Now, maybe that's not a surprise because I'm a marriage and family therapist. So of course, maybe I think that. But to me, there's such a huge aspect of this with family. We already highlighted some of the experiences patients have where they feel that they're burdening family members and that worsens their mental states. But then family members are at the same time experiencing burdens from it. Maybe they're having to do more at home. Maybe they're experiencing their own fears, their own sense of loss, their own changes to normalcy. And something that can be really hard for them is, who do they talk to about it? They don't want to complain to their partner or their child or their parent, who's the one that's suffering the condition themselves. They don't want to go to them to talk about how hard this is for them. And so there can be a sense of isolation for family members too. We'll talk more about all of these common experiences as we move forward, but I appreciate the comments that came through, and I just want to set the stage as we start thinking about this in terms of how it impacts our lived experiences. What I want to do now is introduce a couple of frameworks that I think can be helpful in understanding how to adapt to chronic illness, how to cope with illness as in the best way that we possibly can. So the first theoretical framework that we'll talk about is called the ABCX model. This is an old model. It was proposed in 1949 by Hill. But I find it to be really intuitive and really useful and simple. That's one of the things I love the most about it. So how we can kind of approach this model is realizing that as someone gets a diagnosis, or maybe as someone's symptoms worsen over time, that certainly causes stress to both individuals and families. And in terms of understanding how well someone's going to cope with these stressors and these challenges associated with illness, there's really two key constructs that we can zone in on. One is access to resources. And then the other is how they're making meaning of the experience, their perceptions of the experience. And those two influence each other. And in tandem, a person's resources and a person's sense of meaning making shapes how well they adapt. So a couple of examples of resources, there's millions. There's of course healthcare. There's of course health insurance. There's socioeconomic status matters when you have access to resources and supports. Maybe someone has a chronic condition that makes it really hard for them to clean the house, and so access to resources matters. Can someone get support? Can someone have neighbors or friends or people that come help them do some things around the house? Do they have those sorts of connections? So social experiences, engagement in communities, all of those sorts of things are resources that can shape wellness. The other piece to this is the meaning making. So how is someone making sense of the illness? Are they blaming themselves? Are they finding deficiencies in themselves? Are they beating themselves over the head, thinking they could have stopped this if they would have done something different? Are they thinking this is a punishment from a higher power? Are they burdening themselves with a sense that they are burdening their families? Are they engaging in ways that are things that are more adaptive, in ways of making sense of this that are more healthy? What's that process look like? And those pieces will shape outcome. Another theoretical framework that I'll suggest is actually rooted in some research that I've done. And I hesitate to do any self-promotion. I hope that it isn't viewed that way, but I think this is an additional thing that can maybe be useful and helpful. I interviewed a bunch of couples that experienced chronic migraine, and I tried to explore the process that couples go through in adapting to chronic migraine and what determines how well couples are able to adapt to this condition. What we found is that everyone dealing with chronic migraine, and what I would say is I think this can be expanded pretty naturally to a variety of chronic conditions. People that experience chronic conditions, there's burdens and costs associated with the illness. It's unavoidable. It impacts us. But what we found is that there were these kind of categories that helped determine the adapted state of an individual. One huge thing was the couple relationship. Now, this is, of course, is specific to couples because we were interviewing couples, but we were finding that the state of the relationship had a huge influence on the adaptation of the couple to the illness. Also, their engagement in coping and resources, their access to healthcare, and then this identity piece, kind of how they were personally making sense of what was happening to them. And all of those factors combined seemed to shape the adapted state of the couples that we interviewed. In the next slide, we offer a framework for kind of what this might look like in practice. And so we started shading this model, and the darker the shading, kind of the less adaptive, the more challenging things were within each category. And the lighter, maybe the healthier or more adaptive the experience was. And so what we found is that it was the sum of all of this. It was the sum of the couple's experience and their challenges with healthcare and what coping mechanisms they were utilizing and how they were integrating this into their own identity. It was all of that combined, both the dark and the light, that was the sum of this adaptation for them. So in the next slide, we'll take this theoretical framework, some of these ideas, and we'll consider what are some specific things that you or I can do, maybe in our own personal lives with illness, maybe as clinicians who are trying to help people and families cope with the psychosocial impacts of their illness. What can we do? What are some things from the research that will help? So the first thing is finding support groups. This is huge. In the research that I've done, it comes up as like the first thing that people talk about, that as they found others that were suffering from some of the same illnesses, whether that be through in-person connections, but mostly through social media. Honestly, I think Facebook groups are the #1 way that people are finding these connections. But these connections were pivotal for them. They found others that knew what they were going through. We had a comment earlier about the shame and the sense of isolation, and finding others that know that same feeling, that you don't have to try to explain it to, that you just understand it. It makes a big, big impact. Another thing that happens in these groups is people share tips with each other. I think medical providers, for good reason, can sometimes be a little bit hesitant to encourage folks to go on to social media groups, because you can't control the knowledge that's thrown out there. You can't control the narratives and the suggestions. But in the research that we've looked at, people find it helpful to at least get some ideas. And then a lot of people, if they have a good connection with their medical provider, can maybe take what they're seeing in these groups and go to their provider and say, hey, what do you think of this? Is this a good idea or not? And so there can be some back and forth and some collaboration in that experience. But connecting with support groups for both the patients themselves as well as the family members, and finding other people that know what the experience is like, is a huge resource and help. Another thing that comes out in the research is advocating for yourself as you're receiving healthcare. This is a hard thing to summarize because there's a huge spectrum. There's some people that have found a provider that they just love, almost view them as a family member, and get amazing care. But the bulk of the experience for people suffering from chronic conditions is pretty profound dissatisfaction with their medical care. At times, even real anger about it. Sometimes people feel like they're dehumanized. They feel like the psychosocial experience isn't ever paid attention to, that they're just kind of treated physiologically, but that no attention is paid to all of the challenges that they're coping with. They feel like their medical provider doesn't listen to them or take them seriously. They find things that they're excited about and their provider kind of dismisses it offhand. Those sorts of things are pretty common in the experiences of people with chronic conditions. And so what's the solution to it? There's a few. One thing that I'll say is a lot of people end up searching until they find the right medical provider, one that they fit with, one that they feel like listens to them and collaborates with them and wants to work in tandem to try to find solutions to the best ability they can. So for people that have had really negative medical experiences, I would encourage you to not give up on medicine altogether, to keep searching, to keep trying and looking until you can find that medical provider that you click with. And then within that same realm, there's a process of advocacy with that provider. So speaking up, sharing your concerns, saying, hey, can I tell you something? And that can be challenging to do. Medical providers are so stretched thin. They have really limited time for appointments and they're trying to rush through. But I know medical providers care. That's why they got into the profession. And as patients voice concerns, as they voice things that they're really curious about, as they speak up for themselves, it can make all the difference in the world. Next slide. Another really common and useful process to understand is the process of grief and acceptance. At the end of the day, a lot of times we try to not grieve when we get a chronic illness. We try to just kind of suck it up, buttercup. We try to just keep fighting and not let ourselves feel. In what I've seen, that isn't all that healthy. There needs to be a process of grief, and sometimes that takes time. I think sometimes it's good to just be a little numb when you get a medical diagnosis that's really challenging. It's okay to just kind of stuff it down and avoid it. But eventually, as we get these serious medical conditions, there should be a grief process. There's inherently a grief process, and it's okay to grieve. And it's in grieving as both individuals and families, in letting ourselves feel that we can come to accept, our new situation that we never anticipated, and we can try to make the most out of it. I'm not proposing that we just give up. I'm not proposing that we stop trying to find a cure, that we stop trying to improve our lived experience. But I am proposing that in accepting what is in the moment and trying to make the most out of what is, that is where a lot of health and successful adaptation comes. And so in cultivating mindfulness and a sense of gratitude, in drawing from spiritual and religious practices that help us to make meaning in ways that are healthy. Oftentimes I find patients who are drawing from religious practices in ways that aren't all that healthy in how they're making meaning. So it can kind of be a give and a take, but for so many patients, they find real meaning and purpose in drawing from their spiritual and religious experiences to understand what's happening to them. We can utilize ritual to grieve. We can almost have certain kind of celebrations or ritual experiences as families to kind of celebrate what was and look forward to the future with an understanding that it's okay to grieve what's been lost. All of these things can make a huge impact. My last specific tool that I'll provide is utilizing therapy. Now, of course, I'm a therapist, so I guess you need to consider the source. But I have found that there's a lot that needs to be said. Patients are experiencing a lot of burdening and shame and guilt and depression. Family members are too. Oftentimes when it's a child who has a chronic condition, their siblings feel that don't have the condition, feel like they're being ignored. They feel like they're kind of left out. This impacts everybody. And so utilizing therapy for both the patients as well as maybe partners that don't know who to turn to, don't know who to talk to, they can find that person to unload some stuff with a therapist. Getting families in, maybe having some sessions where the child that's diagnosed with the condition isn't the one in therapy. It's maybe the parent or parents and the child or the children that don't have the condition, that feel like they're left out and ignored. Utilizing therapy to its fullest extent is a very invaluable resource for people coping with these serious medical conditions. With that, we have a few minutes. Oh, wait, I have one last slide. I'm so sorry. And then we have a few minutes for questions. I want to close by just saying that chronic disease has a silver lining in my world. And I get a little emotional when I think about it, but the folks that I've worked with and have met are some of the most amazing people I know. I think chronic disease does foster resilience and empathy. They're as caring as can be. They're as sympathetic to others and their pain as I've ever found. They're beautiful souls and families that are close, that can really have a profound sense of humor, that are strong. I'm so grateful for the people that suffer from chronic illnesses, but adapt in the best ways possible. And I have found in them some traits and qualities that I don't know are forged in any other way. As hard as it is, the empathy and the closeness and the resilience that's gained from suffering with chronic disease is a beautiful thing. Again, we don't need to have any questions, but if there are any questions, I would welcome them.
Yeah, absolutely. Thank you so much, Doug. Again, if you do have any questions, please do submit them on the chat feature, and we'll take a couple minutes here to answer as many as we can. As you're kind of thinking about what your questions might be, I wanted to let you all know about our next webinar coming up on November 17th. Same time, same place, so at noon. That one is going to be led by Tanner Clark. He's another one of our very talented therapists on our team here at Covenant Family Solutions. He's going to be talking about grief and loss, and especially how grief and loss relates to the holiday season that we're very quickly approaching. That can be a really difficult time for a lot of people while everybody else is wanting to celebrate. So Tanner will kind of dig into that a little bit. I have one question for you, Doug, so I'm going to throw that out there. So we're asking, how do I balance wanting to be honest with my loved one about my concerns without being too negative or dark?
That is such a good question. Honestly, it's a little bit hard to know the answer depending on the circumstance. So there might honestly be occasion where the family does need to not drill into all of the hard emotions and experiences. I think, avoiding and numbing is sometimes a healthy thing in chunks of time where we need it. So that's certainly a possibility, but there's other times where it's okay to share the hard stuff. I believe we're really resilient, and I believe relationships are resilient when both people are trying. And so it's okay to share hard things. It's okay to, we don't always need to be like finding the happy things and just like pretending it's okay. So I would just say it depends, which is ultimately the answer. But it's also, we don't always need to be cheery. We can say the hard things, we can share the challenging things. And it might be hard, it might be stressful for the relationship for a moment, but I think relationships are resilient, and ultimately it's in that sharing and those tough conversations that we get that relational closeness that we find in couples that have adapted in really healthy ways to chronic disease.
Yeah, absolutely. Such good advice. Okay, well, if we don't have any other questions, we'll go ahead and wrap it up here today. Again, Doug, thank you so much for sharing your knowledge and giving us all lots of food for thought as we either approach serious medical conditions ourselves or are connected to a friend or loved one that is facing some sort of diagnosis. Again, same time, same place, November 17th. So right before Thanksgiving, Tanner Clark will be talking about grief and loss. Do watch your emails for both the recording from today and the invitation to register for next month's webinar, and we'll see you all back here then. Until then, have a wonderful rest of your week, and we'll see you again soon. Thank you. Bye-bye.